Paramyxovirus is called Respiratory Syncytial virus. This is one that is very common in children, and it's actually one of the most common causes of fatal respiratory infection in infants and children. And some studies estimate that, nearly 100% of children are infected by the age of 2. And so it can be very scary because, as you might guess by the name, respiratory syncytial virus, it forms syncytia in the respiratory tract. So it can induce that syncytia formation, which eventually can lead to cell death. And the necrosis, right, that happens in the bronchi or the bronchioles can actually clog up the airways. And, the same thing can happen in adults, but with infants, remember, their airways are very small. They're tiny people. So they have tiny passages and they can get more easily clogged. What we have seen in the past is that infection is not protective. So patients who have had respiratory syncytial virus can get it again. And this is a little bit different from what we see with some of the other paramyxoviruses. We often see that if a patient has had measles or mumps, they don't tend to get it again. And if they've been vaccinated, they don't tend to ever get it, usually. And previous iterations of vaccines that have been developed actually lead to enhanced secondary infection. So instead of the immune response being protective, when a patient has been vaccinated during like a clinical trial, if they've then been exposed to the virus, they actually develop a worse infection. And a lot of that can be because of immunopathogenesis. The immune system is not reacting the way we want it to. It's overreacting and causing more significant symptoms. We see something similar when we talk about dengue fever. So when we start to get into our arboviruses and talk about dengue fever, that's a relatively common thing we see with dengue as well. But I say recently, very, very recently, this was, I believe, either in the summer or during the early fall, the FDA finally did approve a vaccine for RSV. Unfortunately, it doesn't protect that pediatric patient population. We're looking at protecting the elderly, and there's nothing wrong with protecting the elderly. That's totally fine. But the vaccine doesn't work against that really at-risk pediatric population, or it hasn't been tested and approved for that. But the other thing that was approved to protect pediatric patients is a preformed monoclonal antibody, which they now are recommending to give to pregnant women so that the antibody can protect the neonate from infection. So RSV, that's what they abbreviate respiratory syncytial virus as RSV. It tends to follow similar patterns to like flu and COVID season, where we see spikes in the winter. So last year and the year before, people were really kind of freaking out about this potential of a flu, COVID, RSV season affecting children, especially when children were not eligible for the COVID vaccine yet. Worldwide, they estimate 64 million cases a year, leading to 160,000 deaths. In the US, 230 children under the age of 5 or adults over the age of 65 are hospitalized annually, with approximately 14,500 deaths. Now, the majority of the patients that actually need to be hospitalized or end up dying of the infection end up with a lower respiratory tract infection. It gets down into the deeper tissues of the respiratory tract, and instead of causing just an upper respiratory infection, it gets into the lower respiratory tract. It's very contagious. It's transmitted by respiratory droplets, just like mumps and measles. So it can be transmitted by aerosols and fomites. So this is the figure from the most recent data, the most recent season, which was the 2022-2023 season. And in blue is your highest incidence of infection. These are children between the ages of 0 and 5. And then in green are your patients over the age of 65. So even though we say that 65 is, a more at-risk population, when you compare the risk for children versus elderly patients, children still are going to be more likely to be hospitalized. So these are hospitalizations. Again, what we look at is when it can cause infection in the bronchioles or even pneumonia, children under the age of 1, people who are elderly, people with chronic heart disease, lung disease, or are immune compromised. Generally, what the majority of children would have if they don't develop more severe symptoms, they would have a fever, runny nose or stuffy nose, and a sore throat. A classic upper respiratory tract infection. And it can have common cold symptoms in older children over the age of 5 and adults who are not elderly. So it can be diagnosed by nucleic acid tests or immunoassays. In patients who end up being hospitalized, they'll often do nucleoside analog treatment. And of course now, for some of our at-risk patients, the elderly, we have a prophylactic immunization, so you can get a vaccine. And for our neonates, the passive immunization with the monoclonal antibody. Any questions about RSV or any of the other para-influenza viruses? Okay, cool. Then let's move on to some of our, one, Orthomyxovirus. So these are also negative sense strand RNA viruses, meaning they have to bring their own polymerase because they have that template that can't be used as mRNA. They're relatively large. They do have an envelope, which can make them sensitive to drying and other environmental insults. But what they have that's unique that we haven't talked about really with other viruses yet is what we call a segmented genome. So when I've been telling you about other viruses, if we've talked about their genetics, they have one genetic molecule. I don't want to call it a chromosome, but that's kind of the best analogy. It's a single chromosome that contains the viral genome. Orthomyxoviruses have a segmented genome. Basically, they have multiple chromosomes that make up their genome. The virus that we're going to talk about in this family is the flu virus, influenza. The genome of influenza is made of 8 different pieces. And because of that, if an animal is infected with 2 different strains of the virus, you can get mixing and matching of those 8 pieces to create new viral strains. And we call that reassortment or antigenic shift. So those are the 2 terms we use when we talk about flu. So the most common orthomyxovirus is influenza A, which tends to be the cause of pandemics. There's also influenza B, not as common, not as severe usually, and influenza C, same idea, not as common, not as severe. During the end of World War I, there was what we called the Spanish flu. That was a pandemic that killed something like 25 million people worldwide. And that was more than died in combat during World War I. So these pandemics can be really, really deadly. And what we saw with the Spanish flu was that younger people tended to be more affected than children or the elderly. I'm talking about otherwise healthy young adults were the patient population that was most affected. And then, just like trivia, because I know these things, I'm going to make you have to know them too. It's called the Spanish flu, not because it originated in Spain. It actually originated The first cases were found in the US, but they called it the Spanish flu because nobody liked the Spaniards. I don't know why. I don't know what the Spanish ever did to hurt anybody, but they were mad at the Spaniards, so it's the Spanish flu. Which again is why we don't call things after place names anymore. Because if we wanted to be really accurate, it would be like the Kansas flu. Nobody really likes Kansas either, so I don't see the problem. But what it looks like is something like this. You have the envelope, you have the capsid and the genetic material inside. And so again, now what we have that's a little bit different is you do get rearrangement and reassortment that can occur in the nucleus. So most RNA viruses don't go into the nucleus, but this one will, and that's where you can get some reassortment happening. Now, I think most people have probably had the flu, so I don't know that it's necessary to really go over all of the symptoms of having the flu, but in the big thick purple arrow is where we have what are the major contributions to some of the pathogenesis. So it gets in through aerosols mostly, replicates in the respiratory tract, causes damage to mucus secreting and ciliated cells, of course those that line the respiratory tract and sometimes the GI tract. The induction of interferon and the responses of the T cells cause a lot of the symptoms that we call flu-like illness. Fever, tired, muscle pain. Those are mostly the cytokine and T cell responses. You also have antibody that can help provide future protection, but it usually doesn't, antibody response isn't what causes symptoms. T cell response and interferon production will. More rare complications of flu, and again, why we worry a lot about flu, is because you can have patients who develop secondary bacterial infection, especially in the lungs, that can progress to pneumonia, right? You already have damage in the lungs because of the desquamination of the mucus secreting cells in your ciliated cells. You have overstimulation of the immune system already, so it's not going to respond properly to the bacterial infection. So you can get patients that develop secondary bacterial pneumonia. You can have some patients that actually do develop viral pneumonia from the flu. Again, it's not as common, but it can happen. And then in some patients, you can get especially involvement of the central nervous system, which can be very dangerous. So meningitis, encephalitis. So again, we tend to think of the flu as, maybe I do feel really bad for a week or two, but then I'm fine. And we think most people are fine, and most people are, but these outcomes are definitely possible and something to be cognizant of. Again, what's happening in the clinical disease, you have an incubation period of anywhere from like 1 to 4 or 5 days. Then the patient will become symptomatic. And really, as the symptoms resolve and the patient enters what we call convalescence. So with convalescence, you may not have symptoms caused by the disease, but you still don't feel well. Your body is trying to recover. You might still feel tired or achy, even though you're not coughing or sneezing or you don't have a fever. Right? It's that period where you're like, man, I was really sick last week and I still don't feel 100%. That's convalescence. And that's when you're most at risk for that secondary bacterial infection. During the early stages of infection and during the symptomatic period and just following the symptomatic period, you can generally detect the virus in respiratory secretions. So flu is one of those that can be tested if you go to the clinic or your doctor's office. Antibody, as you might imagine, shows up later, especially if you've not been vaccinated before, or if you've got a strain that you've never seen before. The antibody takes time to develop. And again, what's happening is very early. You get the induction of the interferon. That's what makes you tired, causes your fever. And then you have the cell-mediated immune response and the pathogenic changes in the respiratory tract. That's going to be your sore throat, your coughing and sneezing, right, because of the virus and the immune system working together. Again, the really unique feature about the flu, and the thing that makes it so that we constantly are supposed to get flu vaccines, and even if you get the flu vaccine, that's no guarantee that you won't get some other random flu that starts circulating around, is that resortment. So here they give you an example from 2009. We started with a particular North American avian strain. Those tend to circulate through waterfowl. They can affect other types of birds as well. I think relatively recently, egg prices went through the roof because flu went into the chickens. And so everybody was losing their chickens or having to cull their chickens. So that's why egg prices went up. So there was an avian strain, a human strain, and a swine or pig strain. Somehow, all three of those got into a pig. And so if we label the genetic pieces, right, the segments 1 through 8, you have avian 1 through 8, human 1 through 8, swine 1 through 8. In this cow, or pig, I'm like one of my kids, cow, everything's a cow. You have avian 1, human 2, avian 3, human 4, swine 5, right? You have that mix of chromosomes. Then there was another swine that had a different type of flu. And then there was a Eurasian swine that had its own type of flu. And then they got together in this pig. And so now you have a pig that's got avian, human, avian, swine, swine, Eurasian swine, Eurasian swine. It's a brand new thing. And then it got into people. And that was the swine flu in 2009, what we were calling the swine flu back in 2009. So it's difficult to predict what's coming. It's difficult to fight and protect against whatever mutant virus is going to pop out of a bird or a pig or your next door neighbor.
How does it go from like a human to a pig and then a pig from a human?
They are not necessarily animal specific. So they're not human specific viruses. They can affect a broad range of animals. They're not even mammal limited. So flu viruses, they like to bind cells of the respiratory tract, but they're pretty general in that they'll bind the respiratory tract of almost anything. Like rabies will go into the nervous system, pretty much any mammal.
So essentially, if you're like around a pig who has like those, you're just around it,
Es posible, yes.
Oh wow. Okay.
So that's why, of all the science, like infectious disease, end of the world disaster movies, Contagion is a really good one because that's what happens. So, sorry, spoiler alert for Contagion if you haven't seen it. Like, it's been 12 years. Like, if you haven't seen it, I'm sorry. Mm-hmm. It's a bat pig flu virus, basically. I don't remember if it's a flu, but it's a bat pig virus. And what you see at the very end, because they track it back from the beginning, and everybody gets sick, and there's all these issues, and everybody dies, including Gwyneth Paltrow. But she dies in the first 10 minutes, so don't worry about it. And then what you see at the very, very end is a bat in a forest that's being logged. The bat flies out. It's eating like a banana because it's a fruit bat. And then the banana drops into a pig pen, and one of the pigs eats it. And then you see the chef at the casino in Macau or whatever, prepping the pig. And then he kind of just does this on his apron and shakes Gwyneth Paltrow's hand. And she's the first one that dies of the virus. So I know it's dramatized for a movie, but that's kind of what can happen. The bat pig flu in that one. And here's the bird human pig flu. Yeah. You never know what's coming. Okay. So acute influenza in adults, this is going to be the most common manifestation of the disease. Fever, tired, muscle ache, sore throat, cough, generally without mucus. In children, it's very similar to what we see in adults. They tend to run a higher fever. Kids are also more likely to develop GI infection as well. So they can have diarrhea, vomiting or abdominal pain with their flu. Children are also more prone to developing middle ear infections after a lot of infections, including flu, because their eustachian tubes that drain the middle ear are a lot smaller, and they tend to get swollen when there's an infection, like a viral infection. They can get swollen, which causes the buildup of fluid and bacteria in the middle ear. They can also have more frequent, like more severe muscle pain and croup, which is like a really deep, productive cough. Like, so they could be coughing up sputum. And then the complications are listed here. Rare, but do happen. Primary viral pneumonia, secondary bacterial infection, cardiac involvement, neurological involvement. So most often is diagnosed by symptoms, seasons, and presence in the community. Basically, if we know that flu is around, it's the winter, and everybody else in the community is getting sick with flu, you're probably going to assume that you have the flu too, or at least you would have before COVID. Now you're like, COVID, flu. But you probably have COVID tests at home, so you can figure out, not COVID, probably flu. There are laboratory tests that can be done to confirm flu, to identify the type, is it A, B, or C, to identify the strain. But again, I've had the flu, I don't know how many times. I've never been to the doctor when I had the flu. Most of you probably don't go to the doctor when you have the flu. Hopefully you just hunker down and, you know, you suffer through. You can binge watch something on Netflix. Most people will generally treat the symptoms. They'll take a fever reducer, something to help with throat pain or cough. Right. There are drugs that can help. So Tamiflu is the really common anti-flu, antiviral. So Tamiflu works by inhibiting some of the unique features of the flu that are not found in other viruses. But the challenge is you have to be diagnosed and prescribed Tamiflu within the first couple of days of flu infection. So if you've been sick already for like 3 or 4 days, then you go to the doctor, then you have to wait for the diagnosis, and then you get the Tamiflu, it's probably too late and you just have to let it run its course. But flu viruses, you've probably heard them called like H1N1. So H is a protein called hemagglutinin. It helps them to bind and uncoat inside the cell. So there are drugs that can help inhibit the uncoating because it's so unique. N is neuraminidase. It helps them to escape the host cell. And so some drugs can help inhibit the neuraminidase so they can't escape and cause infection in other cells. Of course, we recommend vaccination annually. The vaccine generally is protective against what scientists and healthcare professionals predict will be the 3 most common strains of flu infection that year. Right? Whether or not it works, we don't know. I generally get the flu vaccine every year, and I got it in fall of 2019, and then in like February of 2020, I was on my butt for like 2 weeks, and I swear I was like, I had COVID. And then I went to the doctor, and they were like, no, you don't have any COVID antibodies. You had the flu. I'm like, bummer. I thought I had gotten COVID over really early, you know, before it was cool, I guess. But no, it was flu, even if you've been vaccinated. So I was unlucky in that I got exposed to a strain of flu for which I was not protected. So again, vaccine recommended annually. I did just see a couple of headlines about flu vaccines so one of the recommendations is that if you are not elderly, that you get the flu and COVID vaccine at the same time. If you're elderly, get them separately because there's a risk of stroke in patients who are elderly. The other is that I think Moderna is working on developing a combined flu-COVID vaccine that would just be one shot to protect against both infections. And I don't remember which company, but there is a company that makes a flu mist. It's a live attenuated that you put up your nose. That doesn't come around that often. I got one maybe 10 years ago was the last time I remember seeing it. But they're saying they might develop that that you could do at home. So you wouldn't even have to go to the clinic. You could order the flu vaccine and give it to yourself at home through a nasal mist. So that would be nice.
So for Professor, you said that it's going to be required, like they cannot take at the same time, both of them, or like you just leave it allowed, or they cannot take it? Or
Oh, you can. The FDA just recommends, because there is a stroke risk in elderly patients, that elderly patients take the vaccine separately, but they recommend that younger patients take them at the same time.
Because I work in a pharmacy, and whenever they come, like the pharmacist recommend them to take it at the same time, even older people. Like
No, it was pretty new. It just came out late last week or over the weekend. Yeah, where they said that there was a slightly increased stroke risk in elderly patients. But old people are usually retired, so they can go to the pharmacy all they want. The idea behind like telling younger people to come in is because we're lazy, and I'm like, oh, I have to go to CVS and like get my vaccine. I don't have time for this. So just do them all at one time. So if you go and do everything at the same time, then you're more likely to get it done. This was a headline from a few years ago that the flu season got started early. Get your flu shot. This woman lost her teenage son to flu complications. Every year, the numbers differ. It depends on the strain. It depends on whether or not we've got COVID and everybody's wearing a mask and washing their hands and staying at home. Depends on how many people have been vaccinated, whether or not the vaccine was good. But in the US, we see anywhere from 9 to 35 million cases of flu per year, anywhere from 140 to 710,000 hospitalizations, and in most years, 12 to 56,000 deaths. One of our last really bad flu seasons was 2017, 2018. 49 million people got the flu, 960,000 people were hospitalized with flu, and 79,000 people died. And it says, the little fine print says, more than the average number of people who attend the Super Bowl every year. So you could fill up a whole football stadium, and all those people died of the flu. So it can be a really significant burden, even just in the US.
Is the number of cases and like hospitalizations just what was reported? Because obviously, like you get the flu, you don't always go.
Hospitalizations is generally pretty accurate. Cases is partially accurate, partially estimated.
Okay.
And then these are showing like what was the predominant virus that went around, how severe was the season. So it goes back from 2012. So here's that 2017, 2018, right? It was a very high, severe season. It was influenza A, and it happened to be one of the H3N2s. There was not enough data from 2020, 2021, because that's when people were actually washing their hands, wearing a mask, not going out. And then, the conspiracy people are like, well, what happened to the flu? We don't have any flu this year. I'm like, y'all are being clean. Like, of course there's no flu. If nobody's walking around sneezing on everybody, like, you don't have the flu. Why is that a surprise? It's not a conspiracy. And then, of course, when we stop doing that, back comes the flu. Magic. And then this was, so flu season, it generally peaks in November, December. So this was the peak week that I found, the week ending November 26, 2022. Anybody know what that week is? Thanksgiving. So last year, Thanksgiving week was peak flu season. And so you could see the purple represents like the highest burden of flu. And then the next week it was less. We are 3 weeks into flu season right now. Flu season starts the first week of October. Well, so there's 3 weeks of data, but we're like 4 weeks into the flu season. And so far, really the only state that has high levels of flu is Alaska. I don't know what they're doing up there. Not getting vaccinated, I guess. Okay. Any questions on flu? Go get your vaccine. Don't get them in the same arm, though. That was not pleasant. My arm swelled up like right here. They was like, oh, do you want to do them in the same arm? I was like, sure. That bad pharmacist. Don't recommend it. No, it was fine. Just was itchy, which means it was working. All right. So some of the sections coming up only have like a couple of slides. There's only like one disease, so we go through it kind of quickly. Okay, rhabdoviruses are also enveloped negative sense strand viruses. The major disease in this family that we see in humans is rabies. So rabies is endemic worldwide except for Australia. If you follow celebrity gossip like I do, because what else am I going to do? I either followed science news or celebrity gossip. Back when Amber Heard was married to Johnny Depp, I think he was filming a movie in Australia. Maybe she was. I don't know. They tried to bring their dogs in. And they actually did. They brought their dogs into Australia, and because they flew privately, they were able to sneak their dogs in. And the Prime Minister of Australia was basically like, if you don't get your dogs out of our country right now, we will euthanize them. So, of course, they flew their dogs out because they don't have rabies in Australia. They have a very strict quarantining procedure if you are going to travel to Australia with pets or other animals. Hawaii is the same. They don't have rabies in Hawaii. So you can't just be like, oh, I'm going to go visit Hawaii this week and I'm going to bring my dog. Your dog will be in quarantine longer than you'll be in Hawaii. And we worry about rabies because it is almost always fatal. So what happens during rabies is generally, if we're talking about rabies in a human, but rabies in really any other animal as well, you were bit by a rabid animal. So in this case, they're showing a human leg being bitten by what looks like a rabid dog. So the virus gets in through the saliva, gets into the new host, in this case the human. It begins replicating in the muscle tissue. Eventually, it will enter the peripheral nerves that feed that muscle and start ascending until it gets to the spinal cord. And it can be a very slow ascension. It takes time. But once it gets to the spinal cord, it relatively rapidly moves up the spinal cord and infects the brainstem, the cerebellum, other brain structures. And then it can descend into the eyes, the salivary glands, and other organs. Basically, the idea is that if a patient begins to experience neurological symptoms, they are like 99.9% going to die. It's a death sentence, and you can watch it happen. So I tell you that it's almost always fatal. This is the most recent data that I could pull from the CDC. They published this report in 2020, and I guess they got busy with other stuff and haven't published a rabies report since then. But there are two things that I want to point out on here. So, let's see. One, I actually didn't put an arrow on it, but I will, survived. An 8-year-old girl who it's unknown how she actually got the infection. She survived. Usually what they have to do, they call it the Milwaukee Protocol. It's a therapeutic hypothermia. They cool down the body. They pump the patient full of antivirals to hopefully stop viral progression and let the body clean up the cells that are infected. They try this with almost every patient that they do diagnose with rabies. It almost never works. I think of the 100 and something patients in the US that have had rabies, only 3 or 4 have ever survived. So it's not good. And a couple of them have, lifelong neurological complications. Okay, the other thing that I want to point out on here, where you have, date of infection, date of death, exposure, kidney transplant. Okay. The one below it is your organ donor. So the rabies virus that the organ donor had, a 20-year-old male in North Carolina, is generally isolated from raccoons in the eastern US. but it is unknown whether or not he was bitten by a raccoon or whether he was bitten by another animal that had been bitten by the raccoon. But it's the virus that tends to circulate in raccoons. In the US, most people who get rabies are bitten by bats. Okay, but there you go, raccoon. So what happened was when this patient died, he turned up at the emergency room and he was a known drug user. So the emergency room staff just assumed he was having a drug overdose. And then he died, and so they assumed he died of a drug overdose. He died of a drug overdose. We could still use his organs, and they did. Okay, and so that's your patient who died of the kidney transplant. And this has happened a couple of different times. It happened once before 2010, which is why it's not on the list, where an organ donor killed 3 people from the organs that were transplanted into patients. But the rest of these, contact with bats, dog bite in India, dog mongoose in the Caribbean. I don't even know what that means. It was in Puerto Rico, right? A dog bite from Guatemala, bat, dog in Brazil, dog in Afghanistan, dog in Haiti, bat. So bats are the most common where somebody who has no travel history will develop rabies. Dog bites are one of the most common worldwide, where people will get bitten by a rabid animal, come back to the US, and be diagnosed with rabies. Okay. So there's my headline from 2004, rabies-infected organs kill 3 patients. This was a little bit more recent. A 6-year-old Florida boy died after being bitten by a rabies-infested bat. Here he is. So the parents knew he had been bitten by a bat. They knew bats could carry rabies. They washed his bite with bleach and thought that would be sufficient. And then he died. So those parents don't feel very good.
There's actually a show that tells that story.
About the kid that got bit by the bat?
And the first case where they
The organ transplant?
No, the first case where they successfully used the Milwaukee.
Oh, what show is it?
Something's Killing Me.
Oh, okay. I'll have to look that up. Yeah. And then I pulled this headline because, well, at the time I was teaching this class, I lived in Fresno. There was a confirmed case of rabies in a cat that bit a person in Fresno County. So in the US, the most common wild animal vector is bats. So this is from the text, but it's pretty out of date. So in the US, the wild animal we worry about the most is a bat. So if you, encounter a bat, if you find a dead bat, leave the bat alone. If you have a bat in your home or in your cabin, if you're camping, leave the bat alone. Maybe try to shoo it out, but don't touch it. If it bites you, you go to the doctor right away. The most common domestic animal in the US that carries rabies is the domestic cat. In pretty much every other part of the world, 99% of rabies is attributed to dogs. So we have very few cases in the US, at most, maybe 4 in a human per year. But worldwide, approximately 59,000 deaths from rabies every year. 20,000 of those are in India, and they are most common from dogs. So that's why sometimes for people who grew up in India, there's a lot of like dogs are not a thing that they want to deal with. Because that's how they grew up. That dogs are not a thing that we like to deal with. Yes.
But in the US, we're more likely to get a cat
than a dog, yes. Because most people will vaccinate their dogs. Most people don't let their dogs run free. But a lot of people let their cats out. So your cats are far more likely to encounter another rabid animal than a dog would be. And so, but if you keep your cat inside all the time, not a problem. Now, what the World Health Organization also estimates is that about 10 million people per year receive post-exposure treatment So the thing about rabies, I know it sounds really scary and you're like, oh crap, I got bit by a bat, now I'm gonna die. The virus replicates relatively slowly. So if, let's say I had been bitten by any sort of mammal, I mean, you can even get rabies in cattle. So like if a cow bites me, I don't know what I'm doing with a cow and I don't know why it's biting me, but a cow bit me, I would immediately go to the hospital. I got bitten by a wild mammal or some weird mean cow and get the rabies shots. It's a series now of about 4 shots. It is a vaccine, but because the virus replicates so slowly, your body is able to respond to the vaccination, mount an immune response, and prevent the virus from getting into your spinal cord. And that works really well. So if you ever are bitten by an animal and you don't know its rabies status, go get some shots. It used to be far more difficult to get the rabies vaccine. Like the procedure was really bad. My first grad student when I worked at Fresno State was from India, and she took this class with me and she was like, oh, I've had the rabies vaccine. I said, oh, really? And she had been bitten by a dog in India, and it was a series of 20 shots that you had to get in your stomach. So it's no longer like that.
Is there any risk to getting the rabies vaccine or treatment and you don't have rabies?
No. So the question was, if you couldn't hear it, is there any risk to getting the vaccine if you don't have rabies? Nothing beyond the standard vaccine risk from any vaccine. And there are people who get the rabies vaccine before they would ever be bitten by an animal, and that would include people like veterinarians and zookeepers. If you have regular contact with animals, you can get the rabies vaccine before you've been bitten. You would also, if you ever get bitten by a known rabid or an unknown status animal, they will give you basically like a booster. I think for a person who's never been vaccinated before and gets bitten, I think it's 4 shots. If you've been vaccinated before and you get bitten, it's 3. Okay. In the US, anywhere from 30 to 60,000 people a year seek post-exposure prophylaxis for rabies. So, what are the symptoms? Well, for a long time, you're asymptomatic. Days, weeks, months, a year after the bite. And so, like the parents of that boy, well, he didn't have any symptoms. He's probably fine. And then once it starts to get into the central nervous system and the brain, you have kind of early symptoms that mimic a flu-like illness: fever, nausea, loss of appetite, headache, tired. You may experience pain at the site of the bite, where the nerves are infected with the virus still. A few days after that, you now have high levels of virus in the brain and in other sites. Hydrophobia, so you're not afraid of water, right? It means that you won't drink. You can't drink. I didn't put it in here because I find it really disturbing, but there are a lot of videos that you can find on YouTube. And the one I'm thinking of is a patient, I believe in India, and they're giving him a glass of water and he's shaking and he's trying to drink it and he can't drink it. He can't get the water down, and he died a few days later. So that's what we mean by hydrophobia. You have spasms in the throat, hyperactivity, anxiety, depression, loss of coordination, paralysis, confusion, delirium. It's in your brain. It's replicating. It's causing damage. Eventually, coma, low blood pressure, low respiratory, low breathing, secondary infections, and cardiac arrest, which is death. So the confusion, the delirium, the anxiety, the hyperactivity, that's what's the aggression we think about when we think about something being rabid. Like when you talk about a rabid animal, you think it's mean and vicious. It's confused. It doesn't know what's going on. Its brain is misfiring. So it's not trying to be aggressive. It just doesn't know any better. And then the foaming at the mouth is because they can't swallow anymore. The throat is spasming, so they can't swallow the saliva, so the saliva builds up in the mouth and foams, and so that's what the foaming at the mouth is. So diagnosis is usually on the basis of symptoms, but unfortunately, if you find yourself in a situation where you are diagnosing your patient with rabies because they have developed symptoms, you are probably going to lose that patient. That diagnosis, that development of symptoms occurs too late for treatment. You would confirm through postmortem analysis of the samples. You can do reverse transcription PCR. You can do ELISAs looking for antibody titers. But remember, if we go back and look at the chart, antibody titers are not going to be detectable until we're in the neurological phase. So it's too late. You can also see changes to the cell. They have specific cytopathic effects caused by the virus. And again, this is mostly going to be post-mortem. I mean, I guess you could do a reverse transcription PCR and tell the patient, hey, you have rabies. Sorry? You have rabies, you have a couple days to get your affairs in order. Okay, but the CPE is going to be what you'll look at in the brain after the patient has died. The slow progression of the disease is what allows for the post-exposure prophylaxis, that extended incubation time. And even though on there it says 60 to 365 days, don't risk it. If you are bitten by an animal, go, right? Go to the doctor. Get the shots. It's not worth the risk. But that's why one time a student, he was a student, but he wasn't my student. And I think he was working in the advising center at the time. And he was like, can I ask you a question? He was very concerned. I was like, sure, you can ask me a question. I just got bitten by a squirrel. Am I at risk of rabies? I'm like, did it break the skin? No. I was like, was it aggressive? No, I was feeding it and it accidentally. I'm like, yeah, I think you're fine. But then, we tried to mess with him later and be like, well,
Do you think that we still have people dying of rabies because they just neglect to go to the doctor after they've been? Because obviously, you have to be bitten, so you would notice, right? Or
for the most part, people do know that they've been bitten by an animal. One of the cases that I heard about that was by a bat, bats are very small, and I think the patient had been bitten while he was sleeping and didn't know that he had been bitten until, and they didn't actually know what had happened either. When they finally figured out it was rabies, they went to his house, and I guess the attic had bats in it, and some of the bats had rabies. And so that's how they eventually, he must have been bitten in his sleep or something. So, but yeah, generally, I think, in places maybe like India, sometimes people live in villages that are really far away from medical infrastructure. They can't afford the treatment. They can't afford to not be at home working. So they don't seek treatment. But, in the U.S., it's mostly going to be people who knew they were bitten and just didn't go because what's the chance, right? But I'm like, if the chance is there, please vaccinate me against everything. Okay. Any other questions about rabies? Okay, well, that's it for today. We will pick up on